Good evening, everyone. It's Sharing Wellness Promoting Health Wednesday, and my name's Mara Gerke. I'm known as the Wellness Lady, the Herbal Addict. I am a holistic health practitioner. So this month, besides brain health, they also talk about migraine awareness. So remember, the information's for educational purposes. So we're going to talk a little bit about migraines. So what are migraines? They're definitely much more than a bad headache. They're actually considered to be a neurological disease. They exhibit neurological symptoms, making it difficult to function. Some nausea, vomiting, sensitivity to light and sound, weakness. Some migraines are recurring, and some can cause severe pain that's throbbing or pulsing and often felt in one side of your head. Migraines affect a lot of people. Actually, 12 to 15.3% of adults over the age of 18 have reported a migraine headache during the past 3 months. 18% of American women, 6% men, and 10% of children experience migraines. More than 4 million adults experience chronic daily migraines, and that's defined as at least 15 migraine days per month. It's the third most prevalent illness in the world and the sixth most disabling. More than 90% of migraine sufferers are unable to work or function normally during their migraine. And it's actually considered a public health issue. And I wasn't aware of how many people migraines affected until I started doing some research. So what actually causes a migraine? Many research believe it has somewhat of a genetic cause. However, there's many contributing factors, or as the migraine sufferers will tell you, there's triggers. Stress or anxiety, hormonal changes in women, bright or flashing lights, loud noises, strong smells, some medicines, too much or not enough sleep, sudden changes in the weather or the environment, overexertion, doing too much physical activity, wearing yourself out, tobacco, caffeine or caffeine withdrawal, and skipping meals. There's also certain foods or ingredients in foods that actually can trigger them. Those are known as alcohol, chocolate, aged cheeses, MSG or monosodium glutamate. Some fruits and nuts affect people. Fermented or pickled foods affect people. Yeast and cured or processed meats. The risk factors for migraines, which means you're more likely to suffer with migraines if you're a woman, because women are actually 3 times more likely than men to get a migraine. It runs in your family, or you have other medical conditions such as depression, anxiety, bipolar disorder, sleep disorders, and or epilepsy. So there's phases and symptoms to migraines. There's prodromes, which starts 24 hours before the migraine or up to 24 hours before. It could be sooner. Early symptoms usually for this pre-migraine period is cravings, unexplained mood changes, uncontrollable yawning, fluid retention, and increased urination. There's also the aura phase. If you experience this phase, you may see flashing or bright lights, zigzag lines. You may also notice muscle weakness or feel like someone's touching or grabbing you. And this can happen before or during a migraine. You can get a headache or an attack where the headache comes on and starts gradually becoming stronger. And you can also have a migraine without a headache and notice increased sensitivity to light, noise, and odors, nausea and vomiting, worsen pain when you move, cough, or sneeze. And then there's the postdrome after the headache, where you feel exhausted, weak, and confused, which can last up to a day or more. The current treatments for migraine, currently there's no cure, and treatment is mostly focused on prevention and symptoms. The medicines used to treat migraines are usually triptan drugs, ergotamine drugs, and pain relievers. And they say that if you take your medication sooner than later, that usually works out better. They recommend you rest in a dark, quiet room with your eyes closed. Use a cool cloth or an ice pack over your forehead. Make sure to drink plenty of fluids. And consider some lifestyle changes for stress management, diet, sleep, and hormone balancing. It's also advised to keep a migraine journal, kind of like the chronic pain people are recommended to keep a journal, or any chronic illness, to help you figure out your triggers. So some natural things that you can do for stress management: exercise regularly, because exercising, taking a 20 to 30 minute walk a few times a week, produces the feel-good hormones in the body, helps you release stress, gets you outside breathing fresh air. You may also want to practice relaxation or meditation. You may want to consider trying biofeedback. There's supplements you can take for stress. B complex are really helpful because the B vitamins are water soluble, and if your body doesn't use them, they just get rid of them, so we don't store them. So taking those so the body has them when they need them is a good idea. And ashwagandha really helps with stress and sleep. It's actually been shown to relieve symptoms of stress. You also want to make sure that you get an adequate amount of sleep. So it's great to set a sleep schedule so your body gets this rest. So you want to turn your electronics off 30 minutes before bedtime. You may want to use an essential oil to help you relax. You know, I love lavender, so I'll put a drop or two of lavender on a cotton ball and slide it in my pillowcase and just lay down and relax when I have trouble sleeping, and that really relieves my stress and relaxes me. You also want to make sure that you go to bed the same time each night and wake up at the same time each morning to create that routine. And many of you may want to create a relaxing nightly ritual that includes deep breathing, or like me, the lavender on the cotton ball. So essential oils for both stress management and sleep. My favorite oils are lavender, cedarwood, vetiver, and sweet orange. You know, sweet orange to me is sunshine in a bottle. Even though it's a feel-good herb, it's also very stress relieving and very calming. And vetiver is very grounding, very kind of, I don't know, like a woodsy kind of relaxation scent. Same with cedarwood and lavender. You can also eat regular healthy meals. Let's get rid of all those preservatives and sugar. So focus on eating whole foods, fruits, vegetables, whole grains, healthy fats, full of antioxidants. And limit those trigger foods. Again, that would be alcohol, chocolate, aged cheese, MSG, some fruits and nuts, fermented or pickled foods, yeast cured or processed meat. You may also want to eliminate dairy or gluten or both and see if that helps you with your migraines. And they say to limit your salt to like 2,300 milligrams a day. So it's really important to keep that journal to help you figure out your triggers, because once you figure out your triggers, it's going to help you probably get way less migraines. You also want to keep your hormones balanced. If you're a woman and you want some assistance in keeping your hormones balanced, you can Google the seed rotation diet. It's a very natural way to do that, and you can visit hormonebalance.com and search her blog for seed rotation. And if you're overweight, they recommend that you lose some weight, which will occur especially if you're sleeping right, you're getting some exercise, and you're eating regular healthy foods, getting rid of the junk food. Other natural supplements you may want to consider: coenzyme Q10, because it promotes blood flow to the brain, improving circulation. Riboflavin, or B2, is necessary for cell respiration and growth, as well as a B complex. Essential fatty acids, because they help support brain cells and fat metabolism, as well as promoting anti-inflammatory throughout the body. Some people use 5-HTP because it promotes the production of serotonin, a neurotransmitter involved in blood vessel regulation. There's quercetin and bromelain, especially if you have food allergies, because they're both involved and needed for enzymatic functions throughout the body. Magnesium, it may help with the frequency of migraines, check the release of pain chemicals, and also due to potential deficiency. An antioxidant blend, highly recommended, especially if you have food sensitivities and a chemical overload in the body, so your body can manage that free radical damage. Some people take butterbur, and when taken early, they say it may help prevent getting a migraine. but it's getting a lot harder to find in the market. And a lot of people take feverfew, which is traditional use in folk medicine, for headaches and migraines. And then my favorite Bach flowers for emotional balance is mimulus, hornbeam, and gentian. And mimulus because it helps you feel a familiar fear when you can put a name to it. So, if you feel a migraine coming on, you're getting that familiar fear because you're going to get a migraine, and that kind of sets a fear in. So mimulus can help you deal with that feeling. Hornbeam, because that helps you when you feel you don't have a sufficient amount of strength mentally or physically to carry the burden that life's placed on you. So it'll give you some help in dealing with this chronic situation that you're in. And gentian, because it helps you when you get discouraged and depressed, when things go wrong, or when you're faced with even small delays or difficulties. So I think those may be beneficial for you. Essential oils for migraines, there really aren't any, but there are some that may ease the headache pain. Lavender was shown in a 2012 study to help manage migraines using an inhalation method. And these aren't going to get rid of your migraines, they're going to help you better deal with them, all these natural treatments. Rosemary, several studies shows rosemary may be an effective treatment for certain headaches. Peppermint, studies showed that it relieved tension headaches when applied topically to your temples. And chamomile may help with stress and anxiety, which usually preempts headaches. So these essential oils are not going to get rid of your migraine, however, they may be of some help. The other thing that I have heard a lot of my customers who get migraines and they can feel when a migraine's coming on have used the Chi machine, which uses a rhythmic motion in the body, similar to massage. And many people say when they use that, when they feel a migraine coming on, it seems to dissipate the migraine. They still get the migraine, but it's not as intense. And my guess would be that the Chi machine is very relaxing with that rhythmic movement, and you're taking time out of your day to breathe deep and relax, allowing your body and mind to take a break, as well as promoting circulation. So I hope that really helps you with your migraines, and have a great week. I'll see you next week, and we're going to talk about 7 tips for heart health. Thanks.